Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Muhamad Aly Rifai. He's an internal medicine physician and psychiatrist. Today's Kevin MD article is The Continued Unjust Prosecution of Physicians. Muhamad Aly, welcome to the show.
Thank you very much for having me today talking to your audience.
All right, so let's start by briefly sharing your story and journey.
So, by training, I'm an internist and a psychiatrist, and I've done a lot of pioneering work on telehealth. So, I started doing telepsychiatry in 2006 and started also doing telepsychiatry to nursing homes in rural Pennsylvania. And that, for some reason, led me to become under the watchful eye of the United States Department of Justice and the Department of Health and Human Services. So that led to investigations, and a lot of these things were related to errors that were done by the Center for Medicare Services in terms of implementing the telehealth services and telepsychiatry. And this was prior to the COVID time. So not a lot of people were doing telehealth and telepsychiatry. And ultimately, after COVID in 2022, they decided that they were going to bring back this old investigation from 2017. And I was indicted for healthcare fraud for services that we provided in 2017. I did believe in the work that I've done. I did believe in my services. I did believe that everything I did was right. The Department of Justice opinion was actually based on lawyers' opinion, not on consultations with any psychiatrist or any coders or anybody who was experienced in the field of telehealth, telepsychiatry, or even psychiatry. I decided to go to trial. We went to trial. I had two witnesses. I had a coder and I had a practicing psychiatrist out from the community. The jury listened to the evidence that we provided. They felt the services that we provided were legitimate, and they found me not guilty. And I have a long story to tell, and a lot of things that individuals who are out there practicing, who see Medicare patients, who see private insurance patients, that can benefit from my experience and the things that I went through.
All right, and we're going to talk more about that story. You articulated in your Kevin MD article, The Continued Unjust Prosecution of Physicians. So, Muhamad Aly, tell me the first time that you were contacted by the government and first notified that there was potential fraud.
The first time was actually in June of 2019. It was a very difficult day. I was practicing. It was a normal day, and then all of a sudden, 10, 15 agents from the Office of the Inspector General for Department of Health and Human Services burst into my office with a search warrant and wanting records of patients. And it turned out that they gathered a lot of evidence which they did not use, which they did not review, which they did not look at. And fortunately for me, we used that because they basically did not look at the facts. They already made their mind that I was their person, a Middle Eastern physician, a psychiatrist, minority, who basically is doing innovative work. I was at that time also the president of the local psychiatric society in my area. I was the president of the Lehigh Valley Psychiatric Society. So I represented the field of psychiatry. And for the government to say, well, the president of this psychiatric society is committing fraud was a big blow for my professional reputation. And this is why I felt I needed to go to trial to defend the basically integrity of the profession of psychiatry, because partially the government says, we brought in this case to teach psychiatrists not to steal from Medicare.
Hmm. And before going into that experience, just so we be clear, what did these federal agents or what did the government accuse you of doing?
Basically, the gist of the accusation was that we did not provide services. We billed for services that were not provided. And our contention was that we did provide these services based on the coding and the documentation that we had. And the opinion presented was actually the lawyer's opinion. It wasn't a coder, it wasn't an expert coder, it wasn't a psychiatrist. The lawyer said, I don't think you provided these services. And they ran with this case. And What we did is we brought in an expert psychiatrist and an expert coder, and they said, based on this documentation, these services were provided. It was psychotherapy. It was talking to patients.
Hmm.
And they accused us that we didn't talk to patients or we didn't document that we talked to patients. It was all documented. The government misunderstood the coding rules and regulations.
And where did you turn to next? So after that initial shock dissipated and you decided what your next steps were, where did you turn to for resources?
I turned to find effective legal representation. And I was very fortunate to find an attorney, Mr. Paul Hetznecker, whose father is a psychiatrist and whose brother is a psychiatrist. So he knew the field of psychiatry very, very well and very quickly understood what I was going through. And we tried to dissuade the government from actually filing a criminal indictment, but we were not successful. They were just determined that this was what we did was fraudulent. What my practice did, what I myself did was fraudulent, criminal, and they proceeded with an indictment, and we decided to go to trial.
So what other options did you have other than going to trial? What were your other possibilities?
So the majority of people in the United States, the majority of people, and by the majority I mean like 97%, who are indicted end up pleading guilty to some charge. No, very few people go to trial. Only about 2% go to trial. And out of those 2% that go to trial, only half or less than that, probably 30-40% are found not guilty. So out of 100% that get indicted, only 0.4% get found not guilty.
And if a
So
physician
so
pleads guilty to a federal charge, what are the consequences of that decision?
they lose their license, they lose their freedom, they're incarcerated. They most likely will become not able to participate in Medicare and Medicaid program. So they will be excluded for a period of time, depending on the severity of their actions. And basically their career in terms of being able to provide medical services is kind of almost over in terms of the ramification of that what happens. And this happens to the majority of people who are indicted. They end up pleading because they do not want to face the federal government. I was under the threat of being sentenced for up to 40 years.
40 years. Wow.
Yes. And the value of the charges that the government claimed were fraudulent was $180, and they extrapolated that based on services that we provided over 5 years to $1.2 million.
So, given the choice of pleading guilty and potentially facing 40 years in prison, why don't more physicians just go to trial given the alternative set of circumstances? What are the risks of going to trial?
It is very scary. I mean, physicians are scared. Their lawyers scare them that the likelihood of prevailing at trial is very low. Sometimes physicians are not very knowledgeable about the circumstances of what they're being accused of. The government is always very vague and doesn't give you the evidence against you until the last moment. They gave me some evidence that was against me on the eve of the trial. 2 days into the trial, they gave us additional evidence. So basically, if you are not knowledgeable about the evidence against you, you don't go to trial. People plea, but the juries are very, very understanding. They're very attentive, and they are probably going to be very sympathetic to physicians just because of the complexity of the healthcare system. It's not never black and white. It's never this is definitely wrong or this is definitely right. So there's always the opportunity to present the case at trial. So I think physicians, if they're accused, they should go to trial because they will have an opportunity to prevail. I also have a lot of experience with the legal system. Being a psychiatrist, I've testified in court before. I've been in courts before as an expert witness. So I had expertise being in court And that wasn't a very scary experience for me. And I said, I'm going to defend myself and I'm going to defend the integrity of the field of psychiatry.
So let's talk about the trial itself. What was that like for you? How long did it last?
The trial lasted for 6 days. It was very surreal experience. It wasn't your usual trial. It wasn't the trial in a big city where you have a courtroom that was full of people listening and sounds. It was in a rural area, so there were probably one or two people in the courtroom. It was very dystopian. It was the judge, his staff, my lawyer and his assistant, myself, two agents from the government, two lawyers from the government, and the jury, and that's it. It was almost an empty courtroom, and basically our witnesses presented. My lawyer cross-examined the witnesses. I think the pivotal moment in my trial was when my lawyer was cross-examining the government main expert coder. And once she realized the amount of errors that she committed in terms of her report, she started crying on the stand. And I think that was the moment where the jury just turned and said, "This is it. This is it. Where this doctor is innocent." If the government's main expert witness is crying on the stand, this case is over.
Now that you had time to reflect on the case, did you feel that the government acted in bad faith and, as you alluded to earlier, targeted you because you represented psychiatry and the fact that you were a minority?
It's hard to say. I mean, I think it's hard to say. There were multiple things going on at that time. There was a new U.S. attorney. We live in Pennsylvania. I'm in the Eastern District of Pennsylvania. A new U.S. attorney. They were not sure whether they were going to do an indictment or agree to settle this case civilly. But I think there could have been other ways that this case could have been handled that didn't involve a criminal trial. And probably the government having seen this outcome maybe will learn to handle these cases in a different way. So maybe it was a lesson to the government as well a lesson to physicians that they need to fight for their rights and not just cave in and just go to jail and once, because basically now the criminal justice system in the United States is in a way where once somebody is indicted, they ultimately plea. 9 out of 10 will plea,
Hmm.
and they will end up having a criminal charge and go to jail.
And you wrote in your article from beginning to end, this was a 7-year process or something like that.
Yes, yeah, yeah, yeah. It's the investigation. Unbeknownst to me, the investigation started in 2017, and the things were going on with investigations and trying to obtain information and started in 2017 and it ended in May 2024.
And after you got that jury verdict, is this really over? Any appeals or any other repercussions or ramifications, or was it truly over?
It's never over. It's never over. So there's no appeals. The jury verdict is final. So that case, the criminal case is over. They still are trying to levy some sanctions against me. Part of the case also, they wanted to they sent in an undercover person and that was not successful and they're trying to pursue that and we're still fighting legally. So it never ends. Hopefully it'll end sometime in next year, but the government doesn't give up and it'll continue to pursue a person. My patients stuck with me. I continued to see patients throughout this case. The government wasn't very happy about that, but I continued to see patients. My patients stuck with me. Medicare, I'm back in their good graces and they want me to see patients because I'm in a rural area. I'm the only psychiatrist in my area. There's no psychiatrist in my area, and so I have to see these patients that nobody else wants to see. There's nobody else to see them. And so I'm hoping that things will end and kind of the legal trouble will end.
Now, how did this case affect you personally and emotionally?
It's a basically is like somebody had a what was run over by a train. I think that's the best way to describe it. I'm a psychiatrist. People ask me, well, do you have post-traumatic stress disorder? Well, yeah, maybe. I mean, that's definitely in the realm of what would happen to a person when they experience that experience. I can tell you, I was resigned to the idea that I may go to jail, up to the level where actually my lawyer said, well, if you are convicted, you need to decide on which jail you're going to go to. And so I went and visited that jail so I would know exactly where my destination would be if I get convicted. Because if you go to trial, the outcomes are unknown and you could be convicted. And so I went and visited the federal center in Otisville, New York. That's where I would have gone had I been found guilty. So people need to know the outcomes, the possible outcome of going to trial.
We're talking to Muhamad Aly Rifai. He's a practicing internal medicine physician and psychiatrist, and today's Kevin MD article is The Continued Unjust Prosecution of Physicians. Muhammad Ali, let's end with some advice you can give to physicians who may be in similar situations, and then some take-home messages.
Advice, I think legal advice. Find a good lawyer that is experienced in healthcare affairs as well as criminal issues. I think that's very important. Find experts that would help you in your case. The government most of the time doesn't have experts that are helping them. I mentioned in the article multiple other cases where in one case, the Dr. Bothra case in Detroit, they accused Dr. Bothra and his colleagues that they stole $450 million. And then they went to trial and they were found not guilty. So how can you say somebody stole $450 million and then they go to trial and nothing? It all disappears. So it's either there was a big smoke screen or basically doctors need to stand up for themselves. Take home messages, I think, for the doctors is know the coding regulations in your field. We have to know the coding regulations in our field because nobody else is going to help us with those, and make sure that you're following those coding regulations.
Muhammad Ali, thank you so much for sharing your story, perspective, and insight. And thanks again for coming on the show.